Welcome to the video Tracked MBS, identifying patients with chronic and complex needs that are eligible for GP management plans and reviews. For the purpose of this video, we are using simulated data only. To keep up to date with our latest videos, hit the subscribe button and select all notifications. And if you like the video, give it a thumbs up. Open POLAR, select Reports, then select Clinic Summary Report tile. You are now on the Clinic Summary dashboard page. For the purpose of this exercise, we are going to select the RACGP and Practice Active Patients shortcut on the right-hand side. In the dark ribbon at the top, open the MBS drop-down list and select Tracked MBS. The page is broken up into three sections. The top table contains the Tracked MBS item information. The middle section has the Tracked MBS Review Eligibility buttons and a group of selector buttons that allow you to select the cohort status of the Tracked MBS items. And the bottom table contains patient names and status about the Tracked MBS items. Looking at the top table, we have a series of columns. Hovering your mouse over the column names and items in the columns will give you a description of the criterion. The columns consist of focus, tracked MBS items, eligible cohort is the number of patients who are active, RACGP active, and have an active diagnosis of a chronic disease. Active, the patient has an active GP management plan in place. Active review, the patient has an active GP management review in place. To action, total number of patients with items to action. Expired, eligible patients who have previously had a GP management plan but not in the last 24 months. Never had, the number of patients with a chronic disease that have never had a GP management plan at your practice. Partially claimed, this item has been partially claimed. Eligible for renewal, patients that have had a GP management plan that has been in effect for 12 months but less than 24 months. Eligible for a GP management plan review, patients that have a current GP management plan that has been in place for at least 3 months and have not had a review of the plan in the last 3 months. Potential anomalies, this is informing the user to potential anomalies that may have occurred in the claiming of this item. Claimed in a calendar year, number of GP management plans claimed in a calendar year. Claimed in a financial year, number of GP management plans that have been claimed in a financial year. Note the colour-coded columns match the selector buttons below. There is an export shortcut on the very right-hand side which will export this table to Excel. This page automatically highlights the GP management plan tracked item, which is indicated by the little eye icon in the focus column in the top table. You can change the focus by selecting the other tracked MBS items. In the middle section of the page, it confirms the current focus is on GPMP, which is our selected tracked MBS item. If you wish to change the MBS item, you can select the item number in the table above by highlighting the rows. For this exercise, we will use the tracked MBS item GP management plan as an example. To the right under Tracked MBS Review Eligibility, you will see 3 buttons labelled 3 months, 6 months and 9 months. Selecting one of these buttons allows you to toggle the minimum care plan review frequency. The colour-coded select buttons allow you to choose the cohort of patients you want to identify and their status according to their tracked MBS item. Using GPMP as an example, hovering your mouse over the eye for information against each select button will give you a full description of the patient cohort. Starting with the red to action items, you may wish to identify your patients with a chronic disease that have never had a GP management plan. Note the patient list is the default tab for this table. To do this, select the never had, the patient numbers will change and the table underneath will populate with patient details. To export the patient list, go to the patient list in the dark ribbon at the top right hand side. The patient list will populate, and then you will have the option of exporting to Excel. To go back to the Tracked MBS page, select the Back to Tracked MBS at the top right-hand corner. We will now clear the TMBS filters only, leaving the patient status filter and the RACGP active filter in the ribbon. To identify patients who have had a GP management plan in the past that has now expired, that is over 24 months old, select Expired button under To Action. Then select the Patient List menu item and export to Excel. Quick fact, clicking the Export to Excel icon on the right of this table exports the information including patient ID in this table while excluding the patient names in the full name column. Due to privacy, the patient names are available within the practice and not in the POLAR data warehouse where the Export to Excel feature functions. Clicking the Select Combine button, you will get both Never Had and the expired cohorts in the patient list. To identify partially claimed GP management plans that are over 12 months and less than 24 months old, click the Select Eligible for Renewal blue button. To identify partially claimed GP management plans for review, click the Select Eligible for Review blue button, and then select the toggle options to determine the review frequency, for example, 3, 6, or 9 months for the GP management plan review. The fully claimed green section helps to identify the patients with a current GP management plan that we are watching only and have nothing to action. To do this, click Select Fully Claimed green button. The Potential Anomalies yellow section identifies patients that do not fall into any of the other categories and may have a potential anomaly in the claiming of the tracked MBS item. In this instance, the GP management plan or review. To do this, select Potential Anomalies yellow button. The table will provide a list of patients in the cohort based on the tracked MBS item that you have selected and has the following columns and information: patient ID, full name, tracked MBS item selected, for example GPMP, latest tracked MBS item date, latest tracked MBS review item date, potential anomaly ID. Note, when you hover your mouse over the potential anomaly ID item in the column, you will be able to see the anomaly code and the descriptor, active chronic disease count, and most seen doctor. This table has two other tabs called Future Eligibility and Claims Services Trend. Clicking on the Future Eligibility tab will reveal 3 graphs: Future Eligibility for GPMP, our selected tracked MBS item, Future Review Eligibility for GPMP, and Future Expiration for GPMP. These graphs allow you to plan for upcoming patient eligibility based on the time frame shown by clicking a bar on the graph. To see the patient names, go to the patient list up the top right-hand corner as already described. Clicking on the Claims Services Trend tab presents you with a table that allows you to compare tracked MBS items claimed month on month for the last 2 calendar or financial years. Quick fact: under the MBS items shown box, you can manually change the item numbers here to compare claiming patterns for one or more other tracked or non-tracked MBS items. If you found this video helpful, remember to subscribe to the MFIN YouTube channel and give the video a thumbs up. Thank you for watching, and see you in the next video.